Hey folks, we're back. I'm your host, BKP. Welcome on Friday morning to Circuit World here in Blue Ridge. Hey, Jeremy.
Yes, sir.
Was it, my ears not, was that Jeremy or Jamie?
That's Jamie.
Okay. Jamie?
Yes, sir.
How late can they get something delivered next week if they come in and talk to you?
Up to Christmas Eve, 5 o'clock.
Christmas Eve, 5 o'clock. I just want to check. They will deliver something for you. Jamie, this time last year on Christmas Eve, you had two great guys from Circuit World putting a TV on the wall for me about 3 o'clock in the afternoon. Mm-hmm. Okay.
And if you can't see this, our studio here, we're like in a cavern here. I can see 40 feet, and there was another one of these, and then there were 8 big televisions, and then there was a refrigerator over there last week, and they're gone. And you weren't robbed, were you?
This says sold, and I have seen them wait for us to finish the show so they can move it out.
Yeah. Anyway, I just said there were 2 or 3 more of these over there, and they've been robbed. They've stolen everything here. No.
Christmas shopping at Circuit World Blue Ridge. It's time for Ask the Doc with Dr. William Whaley. We always want to thank North Georgia Cancer Research Center here. Great group of people. Northside Hospital, we appreciate you very much for this segment. The information, so thank you, Northside Hospital. The information is great. This is the week before Christmas. So let's go with the tie first.
Okay, well.
Okay.
All right. And one of my patients gave me this tie.
Okay.
And last year, and I think I wore it last year, didn't I? Because I
put me on the spot. Remember? Yes.
Well, you wore this last year, and the year before, and the year before, and the year before. You wear it twice. You wear it one time a year. Anyway, yeah. One of my patients gave me this, and we were talking about the memories. And so yesterday at my office, they had a gift exchange, and we were talking about things that you miss when you were a kid. I mean, and cutting down a tree. Here they got a bunch of these plastic trees. You want to come buy a Christmas tree all made up, they'll deliver this to your house too. But we used to go cut down a tree, and later on, after Jane and I got married, we bought trees. But as kids, we cut down trees, and then we decorated them and everything. And my staff yesterday gave me a case knife. Now, you don't have to be from the South, I don't think, to remember boys got a knife when they were 12 years old.
Yeah, no.
And I think in the country they might have gotten a knife at 10 years old. They got the 22 at 12 years old. But anyway, there was a tradition of giving a boy a pocket knife. And it may be at a different time. So it's been 68 years since anybody gave me a case knife until yesterday. I'm not going to say I felt like a 12-year-old, but it's in my pocket and I'm happy.
Well, the only thing you have to be careful of is when you go in a courthouse, you go.
No, you can't go in. You can't airplane or anything.
You can't do it.
You can't. No, I've even had my fingernail files clipped at the airplane place. It's terrible.
You know, we were talking about this, and we got to move on. But we were talking about this earlier. When you went back to school, 10, 12 years old, whatever. When you went back to school, if you're 10 years old, and don't try this at home, kids, because we don't want you to get in trouble. But it wouldn't be uncommon for 2 or 3 boys getting together and showing each other their pocket knife that they got for Christmas.
Right.
And the teacher would not take them away.
No,
they would say, put them up.
Put them up, yeah. And then at lunch we'd go out to the playground and play Mumbly Pig. Now, if you don't like Mumbly Pig, you got to Google it, because nobody's allowed to play Mumbly Pig anymore. You can't ride a bicycle without a helmet. You got to wear a seat belt. You got to wash your hands. You can't eat dirt. Anyway, so here we go.
All right, you've done it, so I have
Eating dirt.
When we were out and my dad couldn't find us for a long time and we'd finally show up at home, he'd say, "Where you kids been? Have you been out playing Mumbly Pig?" Yeah. And we'd have to wonder, Dad, what in the world? But so I had to share that.
You know
I didn't know what Mumbly Pig was.
Oh, no. Well, I mean, you're old enough. I'm not quite old enough. All right, listen.
Quite old enough.
This is we've been talking when Ray was here. Ray's being quarantined down in the islands one more day, I think. We've been talking about how cancer care has been adversely affected in this year since February. I'll put it that way. The first question that we got here, and this hit the news on Wednesday, I think, I read the American Cancer Society article in the, I hate to say it, New York Times. Ugh, political panel would kill me.
Power through.
Political panel would kill me, wouldn't it? About the pandemic affects cancer patients too. My mother is 3 years after breast cancer treatment and is taking hormones and is in great shape. And before quarantine was bowling 3 days a week. So she's a healthy woman. Her doctor wants to do her visits on the computer and has not seen her since April. Is that safe?
You know, before you start breaking that question down, there's several things to unpack in there. We started here with the COVID-19 updates, and between yourself and Dr. Tidman, from day one, both of you have been telling the viewers, and you know, the only way to put it is people have not stopped.
Yeah, cancer hadn't stopped.
Cancer hasn't stopped.
Yeah,
Diabetes hasn't stopped.
No.
Illnesses have not stopped.
No.
And care for them is necessary.
Absolutely.
So, and now something that, another thing in there, and then you can start working on the answer for our viewers, but the other thing in there is something that's very new to us this year is telemedicine.
We're getting there.
Right.
You didn't even know that.
Yeah.
Okay,
So,
wait a minute. We're going to end up there. All right. Pop that first one up there. Cancer hasn't stopped. That was, you got that one up? All right, so this is a American Cancer Society. That cancer hadn't stopped right there, so neither have we. You know what that was for? That was a fundraising thing that came out with it. Came out in emails. This one right here. Cancer hasn't stopped. So I guess you remember now they got to raise a ton of money, and I'm not going to get into how much of the money gets sent out to people. People look at the American Cancer Society as sort of being the Oracle at Delphi rather than the Mayo Clinic or Harvard or the NIH or the government or something. So anyway, put up the next one, pandemic. This is just the headline off that article. Ongoing virus also has been disrupting critical treatments. You're going to pull that one down, right? This here is the next one she's got up there. It's pretty, but that's a little scary. What's that say right there?
Nearly 1 in 3, 32%.
Yeah. Now
patients.
And what does that say? 54%. Okay, those are delays, and this is emotional impact. What's that say?
64%.
What's that say?
51%.
All right, every one of those percentages are like 50, 60, 30. And they touch every area of cancer care. You can pull that down. People try and read it, and I want to listen instead. It's either the patient did not go in for a routine follow-up, or a diagnostic screening procedure or follow-up imaging procedure. So you got women who've delayed mammography, colonoscopy, or either sex delayed colonoscopy, or men delayed their PSAs. That's between over a half. Then you've got people who are being regularly followed, like this woman with breast cancer, and they delayed their imaging study or they delayed their follow-up visit. I saw a woman yesterday who has not been back since February that actually has significant chance of recurrence, should be being seen every 3 months, needs lab tests every 3 months, and she should have had a scan about 3 months ago. So, I see it every day. So what they're doing is, for reasons that I've altered my travel plans for Christmas, as I told you, but that's to protect a 92-year-old against being around a restaurant and something else. That's different from not going in and getting a follow-up imaging study or whatever. Does that make some sense?
Yes.
I'm making some sense with that. All right. So the issue with this is that, put up that New York Times thing there. I don't that graph. I don't want to scare BKP here, but let me see if I can bring up this graph for you, because it's real, and all of these people that you've got, like your Well, I don't see the darn thing here. Wait a minute. Let me go back to here. Well, this is scary. Now, I'm not really very technical, am I, Emily? All right, so let's go back to there someplace, and that should be about right. All right, I'm having trouble. Oh, there it is right there. Anyway, so what this shows is that how much is the death rate up in 2 weeks, Emily?
39%.
39%. Now, your expert panel said, okay, there's more cases because they're doing more tests, and Ray emphasized that. How much are hospitalizations up in 2 weeks?
16%.
15%.
16.
16%. Deaths are up again,
18%.
and hospitalizations are up.
16.
All right. So, the fact that we're getting more cases reported, say 30-something, that's the more testing. But when your deaths are up 15% in 2 weeks, that's a serious train wreck. And what does it represent? And I hate to tell you, it represents Thanksgiving. That's the Thanksgiving hospitalizations. Okay, pull that back down again. So, where the impact is on going to the restaurant, doing the travel, and paying attention to those figures, it's appropriate. But it's not appropriate, in my opinion, when you get to this business about not getting your cancer follow-up. What's that next one say there about American Cancer Society making strides against breast cancer? As I've shown on here, you can let people look at it and then pull it off. As I've shown on here many, many times, the recurrence rates and the cure rates for particularly breast cancer have been going down dramatically as we have improved adjuvant treatment, early diagnosis, long-term hormonal treatment. What does this say? My mother's taking hormones in great shape and has been bowling. So this emphasizes that what we have been doing for cancer, getting an early detection, you can't do that without the mammogram if you're not going to get it, taking your hormones, radiation therapy, or chemotherapy after surgery if that's what the doctor prescribed, and more, and as important is going back in, getting the blood tests and getting whatever scans or follow-up the doctor has prescribed. So this is making a big deal, a big hit in cancer care delivery, and I don't want to give the New York Times, never do want to give New York Times any beneficial publicity, but the American Cancer Society article was first published in the New York Times and everybody else published it. All right, so that takes us into the next spot. You ready to go? Because now they're talking about the computer. What do you think about, have you done a televisit with your primary care doctor?
But I have not. I have been to my primary care doctor several times. I go to my doctor's.
Well, you did some of it on the couch, but I mean,
yeah,
never mind.
I see my doctors every
Never
Friday.
mind, that's a HIPAA violation.
Yeah,
anyway,
okay.
but anyway, you know, the point is, up here in the mountains, you can go see your doctor. All right.
No, I've not done telemedicine, but that is something that this past year, and
We're getting to it.
Go ahead.
Put that next one up. So now this says, understanding the access to care during the COVID epidemic and surveying how you can improve contact with the patients. So show that next picture here. I did one telehealth visit yesterday, and I did one on Wednesday, and I do a minimum of those, and they're appropriate to be done in that fashion, or patients are coming in. Then on the flip side, you've got doctors who are so frightened of the virus that they won't see anybody. and they're doing all of their visits by telehealth. Pull that down a little, get that next one. So this is the evolution of the telehealth business. It is very important, I think, to recognize that there is a significant real role for the use of telehealth in delivering care to patients. And there are places where it's appropriate in cancer care. We had a big group meeting on Wednesday night, and we're sitting there trying to figure out what patients that are getting sort of a routine follow-up that doesn't require a physical examination can be done where they can get laboratory tests accomplished as an outpatient. We can get the lab tests, and then we can discuss how they're doing and then make a decision about whether they need scanning or whether they don't need scanning. You can pull that down there if you want. Have you been to Australia?
Actually, I have.
Okay. Well, you know, in the Outback, there is a place that I visited with one of your members of the expert panel, is the headquarters of the Flying Doctor Australia organization. And Australia is this great big old huge country that 96% of the population lives within 3 miles of the coast.
Right.
So here's this huge donut with what they call the Outback, where only, say, 3 to 5% of the, 20-something million Australians live, and they're spread out hundreds of miles apart, just long lines of dirt roads. And they all have shortwave radios. And then they teach the mamas, they got newborns, and they got the elderly, and they teach people how to monitor the health of their family. And if somebody breaks his leg or has a heart attack, they've got these airplanes that fly out and pick them up. That's all been done by shortwave radio until the last few years, where now they can actually they can see the kid and they can look at I don't think he's got plague. It looks like he's got German measles or something. They can see his face and they can teach the mama how to do it. Go to that next picture there. Isn't there the one? Is that the one with the? Nope. That's never mind. That was the Muggers one, isn't it? All right. So anyway, one of our friends up here, and he's actually been here before, Dr. Rierick, is doing telehealth now as a retirement, keep from getting bored. I married my wife for better or for worse, but not for lunch, and so now I can spend all day on the telehealth and say I'm working from my house. But he's been a primary care doctor for 30 years. He went through weeks and weeks of training how to appropriately do a telehealth in primary care. And so they teach them how to tell the patient to sit there and mash their neck while they're looking at them, and tell them, get your wife to come in and mash on your tummy. They can do a lot of stuff by telehealth, particularly in primary care, that I guess they're learning from the Australians who've had to do it for such a long time. So anyway, in oncology, the question was, is this appropriate? And the answer is yes. 3 years out, taking hormones, hasn't seen her since April. He can ask her to examine her breast. He can ask her, is she coughing, losing any weight or anything, and she can get some lab tests by having a home health come get them or going by a lab place. So the answer is yes, it is safe, and at some point, shouldn't be now, more than 2 months from now when the vaccine's out, let her go in and have a visit. Does that handle that?
We have traditionally, we've gotten used to, in this country, which around the world, the other people don't have the ability to do this like we do here in America. So we've traditionally gotten used to being able to make our doctor's appointment, being able to go in, being able to sit down with our doctor, getting to know them, having a little bit of conversation, and actually,
becoming friends.
Right. And so what you're saying is, I understand with the telehealth, there's some things where you need that doctor's appointment. You need to go in.
Yeah, the guy needs to
Right.
see you.
Right.
There's a lot you learn from body language.
Exactly. You know, a doctor, you can't see. But then there's a lot of things where that's a great example where around the world, people have had to deal with things via telehealth and things like that for years.
Yeah. Well, you'll remember, I think we had a discussion here sometime back between you and your primary care physician, not on the television, where he was interested, I think, in what your blood pressure was. And or maybe we'll say it's Emily.
It's okay.
We'll say it's Emily. But the question then, the instruction is, look, I need to know what your blood pressure is at home. You know, your office is not a normal visit. Take your blood pressure 4 times a day at home for 10 days, and then email me back the results.
Right.
Well, you don't have to come in. You know, email me back the results. And then you say, okay, all those pressures are great, or no, they're not too good. Come in and let me change. So we've gotten in the last few years to where we are doing more. You monitor your blood sugar, your blood pressure, your weight at home. Email me those. We'll talk about them, and then maybe you need to come in. So this is just the next step in taking technology and applying it to the interface or the intercourse between human beings around medicine. Now in business, we know a lot of these banks and stuff are doing all their work online, telehealth with the people they lend money to, and it may very well be that after the epidemic, the fewer of the bankers will be lending money from their brick and mortar place and be lending it from home. I mean, I think this may change the whole way we do business. But in terms of is it safe for this particular patient at this particular time, I'm going to say yes.
I know we have a second question, so we want to get to that. And then before we go today, just like to hear an update from you on how you think the first week Moderna has gotten approval and how you think the first week has gone
That's on the bottom.
The vaccine. So I know you have a second question.
All right, cool. We're going to do the second question because actually, I saw a patient just like this 2 days ago. But the question is, you talked about MGUS. Now, even Emily over there, who has to write down everything, you can't not remember what MGUS is because we've talked about MGUS in the last 3 years and myeloma and plasma cell dyscrasia
Right.
and all the rest a number of times. But MGUS is the monoclonal gammopathy of uncertain significance. So this guy says, you've talked about MGUS many times in the past 2 years, and now I have it. I feel great. My doctor found too much protein in my blood on a routine lab test done for my insurance exam. Okay, so now the guy is healthy. His insurance company, he did a blood test, there's too much protein, they sent the result to the doctor. The insurance company would not issue my life insurance. So now this got him a little bit worried. I'm a 56-year-old attorney. Never mind. Attorney. And I feel great. I don't smoke, and I run 2 miles 3 days a week. Must I be worried about dying soon? First of all, I want to reemphasize what I say all the time. You aren't sick. If it ain't broke, don't fix it. Don't panic. Now, you'll remember that I told you once before that if you imagine the Atlanta Falcon Stadium seats 88,000 people, and the tickets are expensive, and everybody in there is over age 50, and you drew blood from everybody who walked in the door, 4,000 of that 88,000 would have MGUS, and they aren't sick, they're at a Falcon game. Okay, and we show that next one there. So, monoclonal gammopathy of uncertain significance is simply the presence in the blood and in the bone marrow of those plasma cells that we know can progress to become smoldering myeloma, which that says, or myeloma. All right? Got that, Emily? Pull that one down. And is that chart readable, you think?
Which one?
The next one that's got the... All right, so I'm going to... What I've said before numerous times now, this is real easy. What is the absolute risk of progressing within 20 years to myeloma for people with just plain old MGUS?
5%.
Right. what's the absolute risk of progressing and ultimately dying from this?
2%.
Well, chances are greater than 2% that you're going to die driving down the highway down there, right? So the next question is, must I worry about dying soon? And the answer is no. If you're an airline pilot, I can get your ticket and you can fly. If you're a lawyer, you can practice law. But about twice a year, you need to go see your doctor, have the proteins checked again, and you've got a 5% chance in 20 years, it's not zero, of that happening to you. Well, you got a much higher chance of getting colon cancer than 5%. You got a much higher chance of getting prostate cancer than 5%. So the fact that they found the MGUS is another one of those things we only find because people now get lab tests that are run through diagnostic machinery that finds things that we would never have found back when we were doing lab tests in the office. And the other one of those, if you'll remember, is stage 0 chronic lymphocytic leukemia, where you go for a routine blood count and all of a sudden you got 2% more lymphocytes than you're supposed to have, and they run it through a flow cytometry and they say all of those are monoclonal, so that's just like MGUS, only in lymphocytes, and there are millions of people out there like that. And no, the answer is you're not going to die, and keep on keeping on. There.
You know, I appreciate it, and I appreciate this on different levels, because for our viewers out there, we have to understand where we're at with COVID-19. We have to understand the what's going on today. But so many times we talk about there's cancer, there's other things happening that you got to take care of your health.
Right.
And I really like the way we address two questions today in the midst of a pandemic, because the pandemic is not, all things.
It's
medical,
different.
right?
It's different too.
This past week, we watched the first people here in America get the Pfizer vaccine, and we heard yesterday, I think Moderna got their approvals. We have 2 vaccines on the market. What have you seen this week as far as distribution, what we're hearing locally? Bring us up on how you think the rollout has been, and some of the things that concern you or you like on how it's
Well,
going.
I'm not concerned at all. I got an email this morning about 4 o'clock in the morning telling me that 4,000 doses of the medicine are going to be administered to the physicians on staff at one of the hospital groups I'm on staff on in Atlanta, and there's a priority, and we will be getting a rollout email today or over the weekend, but by Monday they expect to immunize 4,000 nurses in one hospital system in Atlanta. So it's there and it's on the ground, and I'm very pleased with that. And simultaneous with that, my understanding is that equal or near equal numbers are going into the nursing homes and to the fine china. So I see it rolling out very rapidly. Now, what really I want to put some, what I think is some science on this and tamp down the fear. You have people that are on your expert panel who I call anti-vaxxers. They are against and suspicious of vaccines. And I saw a number of YouTube and Twitter tweets yesterday put out by people who are saying it is causing Bell's palsy, that's paralysis of the face, Guillain-Barré syndrome, that's the paralysis that came out from a flu vaccine in the 60s, and that a nurse got her shot on TV or she got it in front of a thing and she had an allergic reaction. Don't take it. It's who's the guy that's supposed to be in charge of the virus, the vaccine hoaxes?
I don't know.
Yeah, you know who it is. It's one of these Google guys or Amazon guys or something. Okay, here's the story. The biggest news item in the news today was Bell's palsy attached to the virus. You ready?
Yeah.
Now, we talked about the incidence of disease per 100,000 population, which is how they've been monitoring the COVID virus, right? Or the breast cancer, or heart disease. That's even easier. 55% of people die of cardiovascular disease. So if that number was 100,000, it'd be 55,000 are going to die of heart disease, okay? The community incidence of Bell's palsy is 35 cases per 100,000 population per year. With the Moderna vaccine, there were 12 cases per 100,000 people that were vaccinated by Moderna. The regular rate's 35,000, only 12. Pfizer had 8 per 100,000. So those numbers are lower than what you would consider should be the number in the placebo group.
Right.
So is there something wrong with the statistics? No, these people are being better monitored than the average population. Now, of the Moderna vaccine, of those 12, 8 had the vaccine, 4 didn't. And of Pfizer, all 8 had the vaccine. So it's a tiny number. And the Bell's palsy frequently follows somebody having the flu and being sick, having fever, being in bed for 2 weeks, or some other viral or inflammatory reaction. Well, giving you this antibody is going to have a reaction. You're going to expect a certain number of people to have a sore arm, a certain number of people are going to have a temperature of 99, a certain number of people are going to hurt bad the next day and are not going to go to work. And that's the price that you pay for a flu shot or the old tetanus shots we had when we were kids and the typhoid shots we had for kids. And those are the same kind of numbers you get for any kind of immunization. And the ability to fight off this virus and to not die from it, and Emily just showed you those numbers way back when. Deaths are up 19% and the cases are up 34 to 40%. This is a tiny, tiny, tiny risk or price to pay for taking the vaccine. And when somebody says 12 out of 100,000 people getting Moderna had Bell's palsy, don't take it, it'll kill you. I mean, I don't think worrying about 12 out of 100,000 is an intelligent way to look at an opportunity to protect yourself from a virus that's killing people right and left.
Let me ask you this question. So this past week, you've not seen anything alarming to you that would stop you from taking the vaccine? No,
if I was in Atlanta, I'd probably get a chance to get it Monday.
Okay, now here's another question before we close. Now we're in North Georgia. So you said Atlanta, 4,000 Monday or
this weekend.
This week.
Within the next week.
Okay. When will healthcare workers, nursing home, when would we see it in these areas like this one?
Interestingly enough, nobody knows about Fannin County or anything, but the first vaccines that were delivered in Georgia were delivered to a county that had about 8,000 residents. So the first ones actually went to the country.
So we don't have a direct answer, or we don't have anything that we can.
Yeah, they're not rolling it out to cities before the country. It's going out, and how this is happening, I don't have any idea. I know it takes longer to get FedEx to deliver something to Blue Ridge than to deliver it to Atlanta, but the first vaccines I won't say Randolph County, but somewhere down in South Georgia was the first place to get the vaccine. And the second place was Savannah. Atlanta was about the fifth. So it's going to be up here in a week or two. It might be here this weekend. I don't know.
Well, let me ask you another question, and I can understand if these answers are not out there yet, but for people that are wondering, okay, if the priority line is, healthcare workers, nursing homes, or fine china, senior citizens, okay.
First responders.
When can, and we go to our pharmacies now, we'll just use those as an example, all of our different pharmacies, and the sign says, have you had your flu shot?
Right.
And if you haven't had your flu shot, you can sign up and they'll
Get in
come
line.
out and do it, right?
Yeah, get in line, yeah.
Okay, so I guess where I'm going at is, how far down before somebody just says, I want the vaccine, do you think that might take place?
I'd say probably 4 to 8 weeks.
Really?
Yeah, it might be quicker than that. It might be
So-
2 weeks. It's right around the corner.
So it's very close.
Oh, yeah, it's very close.
That we will have and I hate to call it the A list, but because of the need for first responders, the need for healthcare workers,
Right.
taking care of our senior
And
citizens.
then once it's out of the nursing homes, out of all the first responders, I think the priority will be people that are over the age of 65.
Late February, early March could be an area where,
Well, I don't know, it might be mid-January.
right, where somebody that says, hey, I want to get my vaccine.
Yeah, and people said, well, wait 8 weeks and see what happens. Well, in the first week, you know about Bell's palsy. In the first week, you know about people who are having sore arms and fever
Right.
and a few allergic reactions. So you've had it out there now for about 10 days. So let's say 10 days, this is the 17th. You're going to have 3 weeks worth of experience by January 1. And so by the end of January, you're going to have close to that whole 2 months exposure that we have said. If you really want to be cautious, wait till it's out there 8 weeks. So if it's out there for you at the end of January, the first week in February, that's long enough to wait. Go on and get it.
All right, getting rid of the pandemic, totally getting rid of it. Let me ask you just one more question. How many in America have to take the vaccine for it to work? Not just for them individually, for the entire 350 million Americans, for us to say, there's no concern, because if you have, 30% of Americans that are going to take the vaccine, but then you end up with 35% to say, I'm not going to take it. What do we have to have as far as a population? Where in the population do we need to be
That's talking
for it to work?
about immunity percentage or herd immunity, and that number I've heard everywhere from 50 to 70. But it's greater than half. So if you got half the people, or let's say you got 60% of the people that have either had the disease, ever have had the positive test and therefore immune to it, and then you add to it the vaccine and get up in the 60s or 70s, you're getting where you need to be.
So we need to get over the 50 mark, and that is first and foremost the ones in this country that have underlying conditions.
Yeah, but a lot less than 10% of people have been positive so far and tested. Now, that doesn't mean that there's not many more people that were positive, never sick, or minimally sick and never tested. So until we're going around measuring antibodies and adding to it the vaccine, people that got vaccinated, it's a number you're not going to be able to have any great confidence in. So you'll have confidence in the number of people who get vaccinated.
Because obviously we're very concerned about the health of our children, but when we start looking at the statistics and how this affects age groups, one of our concerns is not as much that kids get it and get over it, it's as much that kids get it and take it when they visit grandma and grandpa.
Correct.
So if they have the vaccine, they take the vaccine, and a kid 9, 10 years old gets this, and they go visit grandma and grandpa, that danger starts getting eliminated.
Yeah, and interestingly enough, I don't know if there's enough data
Now,
on
I'm
this.
not trying to confuse that.
No,
but
you're not confusing.
I sit with somebody this week that has, I think, a 12-year-old son. The lady tested positive for COVID. She went and had the 12-year-old son tested. He tested positive, But if they never knew he had anything.
No, but he probably brought it home.
Exactly.
Right.
So
Well, so let's talk about the 12-year-old getting the vaccine before he gets it. I don't think there's enough data yet to say this, but everything I have heard, and you can't pay attention to what you hear until somebody gets you some numbers, is that the older people tolerate the vaccine better than the younger ones. Now, you remember I told you about immunizing all those Marines with the plague vaccine before going to Vietnam. Every one of those got a temperature of 101, 102, and got sick as a dog. I mean, it wasn't just 2 or 3 out of everybody got sick from the plague vaccine. They were all young, healthy men. Some of them got really sick and went to the hospital. But point is, I think young people have a much more robust immune reaction to a vaccine, so that they're getting a better immunity from it than people in my age group would be getting. And that's the reason that they have more fever and that they have more achy arms if they're 12 than if they're 80. They're getting a better immunity. So I think it's safe. Nobody's studied the kids yet. Remember, the clinical trials on kids under the age of 12 are just now being done. I think the vaccine was released for Americans over 12 or over 16. I forget exactly what it is, but it's not for children. So those 2 vaccines that have been released have not yet been released to be given to children. So that group of kids right now is still an unknown as far as I'm concerned.
close with people out there are going to make their own decision of how they're going to celebrate the holidays in the next couple of weeks. Could you share some of the personal ways you're going to, so that they can make decisions on their own?
Yes, yes, I can.
If they're interested in following maybe what you
All
want
right,
to do.
well, number one, you remember, I'm the guy who said schools should have been open all along. I mean, the teams ought to be playing all along. We have a 92-year-old mother-in-law living in our home. And we had planned to go down to Atlanta and have a nice dinner in a hotel on Christmas Eve, spend Christmas Day with the family that we do spend some time with, that are very safe, and then go down to Callaway Gardens for 3 days and watch the lights. With the figures that Emily showed earlier and some of our own knowledge of people who have gotten the virus recently, I've got a lawyer patient who's a marathoner that got it from nowhere and he's sick. We just decided that it was safer not to go into Atlanta for a meal, not to go to Callaway Gardens, and we are going to go down to Atlanta and visit with a family. So we pulled back to the group of people that we're comfortable with, that they know that we are very comfortable with, and we've eliminated that random exposure to people in a hotel or in an airplane or something like that. I think everybody has to make their own decision. It actually has been said it's safer to be flying on a Delta airplane than it is to be doing any other sort of travel, because the planes are, so crystal clear and they got you separated so far apart. So, I mean, I think you could fly. I'd tell an 80-year-old stay home.
I got it. All right, well, Merry Christmas to you and your family. Anything for closer here?
Yeah, well, one more thing, we always come up with the news of the week, and I told you the first news of the week was that thing about the Bell's palsy. Number 2 was a romaine lettuce E. coli. 12 people have gotten E. coli from romaine lettuce. We had so much fun.
I won't call that the good old days, but I remember
that was
back
the
when
good
that
old
was
days.
the news, right?
Yeah, it was. You can't eat so-and-so. Ben & Jerry's ice cream, it's got that. I'm anxious to go back to where we're talking about the news. We're talking about 2 or 3 states with the romaine lettuce problems,
Merry Christmas, my friend. I appreciate you very much. We appreciate North Georgia Cancer. We really appreciate Northside Hospital for this segment. Don't forget, if you have questions that you would like to get to Dr. Whaley, you can always send those to info, I-N-F-O, at FetchyourNews.com. You can follow us on social media, find Ask the Doc. If you go to FYNTV.com, you can click on Ask the Doc right at the top there, and you can find all the segments, send them to your family and friends. We also have a YouTube channel, FYNTV, Fetch Your News, playlist, Ask the Doc. You can share these also, again, with your family and friends. You can send us questions. and Dr. Whaley will respond. We appreciate you very much. We appreciate you. This is actually, we won't see you till next year. We have 2 holidays in a row.
Wish you a healthy, happy 2021.
Right. So again, exactly. We appreciate it. And as we close our year, I can't say thank you and Dr. Raymond Tidman for coming in. You know, when this first started, I know you brought in Dr. Tidman, a general practitioner here in the area.
And Dr. Marlowe.
And Dr. Marlowe, that's right, exactly. When we started, we would get, is he an epidemiologist? Did I get that?
Yeah, he's
right?
he's an infectious disease expert.
I'm just impressed. Did I say
Yeah, you did. Yeah,
Yeah, I was
epidemiologist
impressed with
and he's always been a viral researcher. First herpes, then HIV, now COVID.
But, you know, Dr. Tidman has been very close with his practice to senior care
Right.
in North Georgia, cancer research, Dr. Marlowe.
Dr. Marlowe's the scientist in the group.
Exactly. I can't, when everything first started, we were sending him messages. He was on the show several times, and he was answering the questions. So I can't say enough on behalf of the viewers this year for the way you worked very hard to bring the research and information. I get messages and people tell me all the time. So thank you very much. I appreciate it.
And God bless the USA.
Got it. All-star political panel right after this. They're waiting. As we always say, wonder if they have anything to talk about. We're going to put them on the spot, test their memory like their Christmas memory. We'll be back right after this.
We ain't talking about Christmas.